Thank you everyone for joining us. All right, let me move my screen here. Okay, so thank you for joining us for a webinar on our AD-PKD patient registry. We're going to be talking about our annual impact report with data from 2022, so last year, and I'm here with Vanessa Holliday. We'll introduce ourselves in just a moment, but first some housekeeping items. All attendees should be muted to ensure good quality sound. The webinar is being recorded so that we can share it on our website going forward. Please submit any questions you have to the Q&A box located on your screen, and we'll try to answer as many of those as possible during the Q&A sections. We are also unable to address specific medical questions, but any questions about the foundation, our strategy, our research programs are very welcome. Okay, our learning objectives. So what we're hoping to do is summarize some of the impact that the AD-PKD registry data is having on research in the space. We want to, of course, highlight the importance that we place on privacy and security of the data from our participants. And we want to describe new features that are launching this summer. Just a disclosure that Vanessa and I are both employees of the PKD Foundation, but have no other financial relationships to disclose. All right, so hi everyone. I'm Elise Hoover. I'm the Vice President of Research Programs at the PKD Foundation. I've been here about 5 years. I'm very fortunate to be able to manage all of our research programs. And I actually got my start as a research coordinator at Tufts Medical Center. So I worked on PKD studies like the tolvaptan trials, the HALT blood pressure study, and I just really felt a connection to the community and to the science. And so here I am, almost a decade later, still in the space. So it's so great to get to talk to all of you today, and thank you for joining us. And Vanessa, do you want to introduce yourself?
Yeah, thanks, Elise. Hi, everyone. I'm Vanessa Holliday, research strategist with the PKD Foundation. I have been with the foundation for about 2 years. And during this time, I worked closely with Elise on the registry, really working on participant engagement and being able to understand the patients that we're working with. And yeah, it's really an honor to be here, and I look forward to sharing with you all.
Thanks, Vanessa. All right, so let's talk about our registry. What we want to do is first start with why we think registries are important to research in general. Then we'll talk about the data from 2022 and what we learned. And most importantly, we want to share with you some of the impacts we're already starting to see from the program. So let's talk about why the foundation decided to launch a registry at all. Our registry is a collection of individuals with autosomal dominant polycystic kidney disease. And the registry as a mechanism has some important differences from a more formal clinical trial, which we see often in research. So, starting on the right, clinical trials, they are limited by study inclusion criteria. They have a set number of participants they can enroll, and ultimately they close the study. And the kinds of data they collect are predefined from the beginning based on the research question they're trying to ask. In contrast, a registry like ours, we have no limit on inclusion criteria. So anyone with PKD at any age, gender, disease stage is welcome to participate. We don't intend to ever close the registry, so we hope that number of participants will continually grow year after year. And we're very flexible with the kinds of data we collect. We're always adding new research questions to our goals, and that means that we can ask new questions, and we're not limited by one research question like a clinical trial. One important similarity, however, is that participant data is separated from your name and other personal information, so you cannot be identified. It's very important to us, and it is very standard for a clinical trial. Just a quick highlight of some other registries you may have heard of or been a part of. A traditional clinic-based registry pulls data from your health record. It requires little engagement from you other than signing the initial consent form. And then a lot of the things they study in those registries are based on things found in your health record, like lab tests, images, that kind of thing. And what's exciting about our registry, we call it patient-powered because we are getting data directly from you about your disease experience. And we rely really heavily on you to not just sign our consent form, but come back and continue to engage with us throughout the year. And then we can also ask questions that help us study things that we can't find in the health record, like quality of life, disease journeys, that kind of thing. So in the history of the foundation, we've been funders and supporters of research, and this is the first program that has been funded by the foundation itself, that's been run by the foundation itself. We launched it in September 2019. It'll be 4 this fall. It's hosted online, and it has 2 goals that are really important to us. You know, one is that we want it to be a tool that helps us to better understand the experience of our community. And the second is we wanted to help us connect people to clinical trials and send them information about studies that they are likely eligible for and that would be relevant to them and their experience. And really overarchingly, we want to advance research to find better therapies and a cure by harnessing the patient voice. It's very important to us that we are patient-centric in this program and in a lot of our programs. We have over 2,700 people signed up in this program with us. Thank you so much if you're one of those folks. If you know one of those folks, thank them for us. But this program isn't just about the data and the numbers, it's about the people who are involved with us. So of course, we like to consider this patient-powered because of the data we're getting directly that reflect patient perspectives. It's participant-centered because we are involving individuals with ADPKD in our advisory groups, in our survey development, and our beta testing. And we're also proud of the program for being as accessible as possible by making it online to participate in. The screen should automatically configure to your computer, tablet, phone, whatever screen size you have. If that's not working well for you, let us know, because it is supposed to. Okay, last thing I'll say before we get to our annual impact report. So this is our process for de-identifying your participation in the registry. As soon as you log in, the system automatically assigns you a unique ID and it removes all your personal details, and that is locked away somewhere that is not accessible. And this isn't a rule or a process that we made up. These are established by the National Institute of Health, the FDA, HIPAA privacy rules, and our entire program is also IRB approved. So if you have reached out to us about perhaps withdrawing from the registry or about trouble logging in, that is the only time that our team can de-identify you. We can reach out and figure out what your login information is, help you get into the registry, and then we de-identify you again. Otherwise, it is locked away in the system. So I'm going to hand it over to Vanessa to talk about our report.
Yeah, thanks, Elise. Thanks for setting me up perfectly. So you all signed up for this webinar tonight to learn more about the registry and specifically for us to talk about our annual impact report. So the registry allows us to collect super valuable information, and we don't just want to keep it all to ourselves. We want to share it for research purposes and with you all as often as we can. So at the end of each year, we've created an annual report to show you what we've been learning. This year, we decided to take it a little bit different direction and focus on the impact of that data. You'll see a lot of charts and graphs along with where and how the registry data has been used within this report. And along the way, we sprinkle in participant testimonials, as you can see here on the right side of this page, to really highlight why this data is so important to help describe the ADPKD experience. And on the left side of this slide is basically our agenda for this portion of the webinar. So you can go on to the next slide. So we'll first start out with recruitment. We wanted to shed some light on what the study population looks like in order to put the data into context. Next slide. So in 2022, we set the goal to increase both racial and gender diversity in the program, and we achieved this milestone. We believe that this is due to efforts led by the PKD Foundation as a whole program, such as peer ambassadors and through engagement and retention work within the registry itself. Even though we have seen improvements, there's still work to be done. You can see this, especially when looking at gender and race, but we are still going to take time to celebrate those victories. And as it stands right now, the registry is available for US residents only. And over the last year, as you can see in this state graphic, Mississippi, New Hampshire, and Washington saw the most enrollment improvement overall. And this is really exciting for us because it shows that we are increasing the reach of the registry to areas that we don't currently have many established participants or connections. So when we're going into the next section about more about the data, this is basically the key to understanding what types of folks are answering our modules. And yeah, it's really exciting. We're super excited to see this continue to change and grow as the program evolves. So data highlights. So in the old version of the annual report, this is what would have made up the bulk of the report. But this year we wanted to focus on the impact and showing you how and where the data has been used. But we didn't want to leave out or miss out on the opportunity to show some really interesting key pieces to what we have been collecting within the registry. So first, we wanted to share about age group at diagnosis by knowledge of family history. So as we have found through the registry and through conversations with our advisory group members, making the choice to discuss your ADPKD diagnosis with your family members may not be easy. And the registry strives to understand the connection between knowledge of family history and age of ADPKD diagnosis, and that is what this graph is all about. So it shows that for this sample, we have around 2,000 folks that responded. If family history of PKD is known, the age at diagnosis tends to be younger than if family history is unknown. The highest percentage differential that you can see here is the 11 to 20 age group is at 74% of known family history diagnosis versus the 50 and older age group at the lowest percentage of 49% known family diagnosis. Next slide. So another interesting group of data that the registry collects, as Elise mentioned earlier, is about quality of life. So that is something that we have been really interested in, and the registry utilizes validated tools to measure and understand the impact that PKD has on quality of life. These scales are called the ADPKD Impact Scale, or the ADPKD-IS for short, and the ADPKD Pain and Discomfort Scale, also the ADPKD-PDS for short. So since these two scales, they only reference the last 2 weeks, we asked them multiple times throughout the year to make sure we're really understanding what the patient, what the participant and the impact of their diagnosis, what they're actually going through instead of just looking at one moment in time. So as we reported here in these 3 pie charts, we asked about over the past 2 weeks, your need to modify lifestyle because of PKD pain and discomfort. In the last 7 days, if your relationships were affected by dual kidney pain, and the last is about in the last 7 days if relationships were affected by fullness or discomfort. So sharing about the impact of pain is really important for a diagnosis for a disease that is progressive, and it's also so different for each individual. Some people experience pain, some people don't, and we don't want to overlook this part of the disease. And as you can see here, there are slight differences between patients at different stages of chronic kidney disease, but overall we can see that pain is a constant feature of PKD. So being able to communicate the impact that PKD has on the quality of your life is very important, as I mentioned, as the disease progresses, in order to investigate treatments and therapeutics that may be beneficial with your clinician. Slide.
Excellent. Thank you, Vanessa. That was great. Yeah, let's get into the impact so far of some of this data. So all of the posters that you'll see in the next few slides are available on our website. We pulled out a specific chart for each to highlight some of the aspects, but we do encourage you to go look at those. The first one is our ASN Kidney Week poster we presented in 2020. That's virtual, of course. ASN was the American Society of Nephrology, and Kidney Week is their annual conference. It brings together thousands of professionals who work in the kidney healthcare space from around the world. And we presented this poster to nephrologists attending the virtual conference to both introduce the program as a research tool and to encourage them to tell their patients about it and have them sign up. So we highlighted a few things. One, of course, is that the registry is a great tool over time to understand a patient's disease journey. It's also a great resource for clinical trial recruitment. And because we know that PKD is not just a kidney disease, it also impacts the liver, the cardiovascular system, and others, we wanted to make sure to tell them that our questions aren't limited to kidney. We also ask about those other manifestations. And another important key trend is what diet and lifestyle looks like in an ADPKD patient. So this table here is dietary restrictions reported by a little under 1,200 individuals. And of course, dietary restrictions can vary based on where you are in your disease journey or personal preferences, or perhaps a research study you're involved in around dietary interventions. But this is just such a great tool to start to understand the trends from the community. All right, Vanessa. Vanessa, you might be muted. You there?
Thank you so much. Yes, I'm there. You would think by now that, we'd be used to the unmuting, but here we go. So this was the poster we presented virtually for ASN Kidney Week 2021. So we presented this again at the American Society of Nephrology, same conference a year later, with updates on how the program has grown, along with members of our patient registry advisory committee that they helped create this poster. And we focused on 3 newest modules looking at impacts of the pandemic, vascular outcomes such as brain aneurysms, and healthcare access. And healthcare access is the module that we pulled this graphic from. So this graph that we used as a call out highlights that the vast majority of patients reporting barriers in access of affordability was around medication for their PKD, especially through Medicare or employer insurance. More specifically, 93% had reported the medication they had difficulty accessing was for high blood pressure, and other barriers were reported in access to specialists and genetic testing as well.
Great. So yeah, let's talk about the National Kidney Foundation Spring Clinical Meeting. So in order to get in front of more clinicians treating ADPKD, we went to this meeting in 2022 to mix it up a little bit. And what's interesting about this meeting is it's designed not only for nephrologists, but also primary care physicians, pharmacists, physician assistants, nurse practitioners, social workers, dietitians. You get the idea. So it's a broad range of people on the care team who attend this. And some of the things we highlighted, of course, that as someone progresses in PKD, they experience kidney growth and kidney function decline, and that, of course, impacts quality of life. So we use those validated tools that Vanessa mentioned earlier, the ADPKD pain and discomfort scale and the impact scale. And we use these because we didn't want to make up questions. Not that we make up questions. We wanted to make sure we use something that was very scientifically and rigorously created to capture these questions specifically for ADPKD. So we use these tools that are considered validated by researchers and by clinicians. And we ask them questions such as this chart about how dull kidney pain impacts sleep, separated out by the stage of kidney function, by the stage of chronic kidney disease that individual reported. And we saw some trends, which is really exciting because that means that as someone progresses in their disease, we can expect to see some of these trends. And that means clinicians can expect to see some of these trends and they can do something about it. And what's most important in the clinic, what's most important in the clinic is that the clinician knows what kind of individuals are more likely to experience pain, to experience dull kidney pain, or impact on sleep. And then they can ask those questions where appropriate.
So our next poster was at ASN Kidney Week 2022. So this was held in Tampa, Florida, and it was our first Kidney Week back in person in a few years. The PKD Foundation had a booth at this conference, and it was great to be in the mix with patients and clinicians. We really used this time to share the value of the registry program as a research tool and to encourage clinicians to tell their patients about it. So we had this poster sitting in front of our booth, and it gathered a lot of attraction. The main points that we wanted to share were that the registry is continuously growing and reaches all 50 states. At this time, as of October 2022, we were highlighting that, we had well over 2,000 participants, which was really exciting to be able to get the word out on that. We also wanted to share updates on population demographics. As seen on the far left side of this poster. In the middle, we talk about quality of life findings. That is something unique to the registry that we're able to collect. So we focus on, for this graph, anxiety about your PKD getting worse, accepting PKD as part of your life, and feeling guilty about the impact PKD has on your children and family. Pulled from our validated tools within the registry. So this was really great conversation starter as well. I had a few clinicians stop by just saying that was really interesting. We were gathering this sort of information, and that they too would, be prompted to talk with their patients more about topics like that. And on the right side, a sneak peek of the updates coming to the ADPKD registry this summer. And then on the bottom, a little bit about highlighting how the registry is used to recruit for clinical trials and clinical studies. And at this time, we had 28.1% clinical trial involvement. So that was really awesome to share with everyone as well.
Excellent. And then we also published a manuscript in the Kidney 360 journal. So this manuscript was an extension of that original 2020 ASN poster that talked about the design of the program. And what's exciting about manuscripts is that they elevate the content that was put in front of experts at conferences, and it ensures a wider audience that can then engage with the information. But I don't want to knock research posters. They are really important for summarizing research information, publicizing that work, generating discussion. And of course, it allows you to highlight programs like this and studies in a short amount of time to a large audience. Manuscripts they're peer reviewed, and they highlight the program as well as a tool to answer questions. But what's really exciting about this is that because we have a paper published that clarifies the design of the program, if a researcher were to publish on results from data in the registry, they wouldn't have to necessarily waste space on talking about the design of the program. They could reference the design manuscript and save room for the results of their research. So this is a really important first step in getting this data utilized and making it really easy to reference and talk about by our researchers. If you're interested in learning about it, it is free and it can be found on our website or on pubmed.com.
So as we have been alluding to and referencing throughout this presentation is that another function of the registry is to be for research recruitment. But also, as Elise mentioned earlier, the registry is an IRB or Institutional Review Board approved clinical study. So this means that everything we place in the registry has been vetted and approved for consumption. And it's really awesome. It's a really awesome way to have a diverse population in this study, since it is virtual and not tied down to one location. And a main benefit of the registry and the information we collect is the ability to recruit for clinical trials. And we know that this is hugely important to the PKD patient population. So far, we have been able to contact over 9,000 individuals who may be eligible for a study. So that includes some people more than one time, but this number is really amazing. So based on what a participant fills out in their core questionnaire, we look at common inclusion or exclusion criteria for studies, such as listed on the screen, and we send that participant an email with a study we think that they may qualify for. So this leaves the power in the patient's hands for whether they want to reach out to the study team and be further engaged. Last year, we were able to help recruit for 7 interventional studies and clinical trials and 11 observational studies or surveys. So this just highlights that adding your data to the registry will inform clinical trials and help fill participant enrollment faster, therefore accelerating discovery of new treatments. And a priority for us is to make sure research is accessible to everyone.
Thanks, Vanessa. All right, now we're going to talk about what we call the first-year participant journey. So this was designed with the help of our patient advisory group, and the intent is to better represent what it means to sign up for the program. So each hoop represents a year or a trip around the sun. And the idea here is that this program isn't just a one-time commitment. We ask that you come back throughout the year to answer more surveys or interact with the features we've created. Those features are really an attempt to return value to you as participants. And many of the surveys or modules, as we call them, such as the core questionnaire, we ask you to update those yearly or quarterly so that we can keep track of your progression. And we'll talk about this later, but we'd also like you to consider connecting your health records to the registry and or utilize our pulse surveys to track impacts on your quality of life. So we have a couple new features that we'll talk about, but of course, all participant activities are optional. All surveys are optional. All of our features are up to you, but we hope you feel comfortable trying some of them with us. And of course, everything in the program is intended to help power research. So by signing up and telling us where you live, researchers can know where individuals with AD-PKD are located around the US, and they often use that kind of information to understand the best locations to put clinical trial and other study sites to make it accessible for you. The questions that you then answer in our modules throughout the year, that's in purple, especially the ones that repeat, help us understand how you are progressing over time. And the blue line there is a health record linkage. So we believe that pairing modules with your health records is really going to accelerate the understanding of kidney disease progression, and also importantly, complications outside of the kidney, which are often undervalued and understudied. You know, long term, our goal is to use this data to help inform care guidelines in AD-PKD, understand what care looks like in different parts of the country, how to standardize the way that newly diagnosed patients are introduced to new care teams, those who are closer to transplant and dialysis, and being able to understand a full picture of what that looks like is incredibly valuable.
So we have really been working on returning value to participants in the registry, and this part of the participant journey really focuses just on that. So the dotted line, the green dotted line at the top represents pulse surveys. So this will be a new feature that we will discuss in just a moment, but the value that is returned to the participant is when you complete a pulse survey, your responses will be reflected on the personal impact calendar. And this calendar will help you visualize what living with AD-PKD is like and provide a conversation tool for physician appointments. So this sort of is that other arm of, okay, so we're filling out these modules, it's powering research, but we want to make sure that there's some added benefit for you as well. So that is what the pulse surveys could do for you. The second purple line is about completing modules. So each time you update your answers or complete a module, your care summary, which is a new tool we created, which I'll share more about, will become more comprehensive and complete. And lastly, the turquoise blue line is about what happens when you choose to connect your health records. So if you choose to connect your electronic health records, we aim to help you understand your disease progression on a better level. And we'll do this by enhancing the care summary, and hopefully in return, this will provide a great conversation tool for physician appointments. So looking to the future, there is some really exciting stuff on the horizon, and we have kind of been giving little sneak peeks throughout this whole entire presentation, but let's get into it. So first, we can start out with the care summary and personal impact calendar. So as just mentioned, we've been focusing on returning value. And so our research team is excited to expand the features available in the AD-PKD registry coming summer 2023, so very soon. And this project has been carefully planned and executed with our patients at the center. The last few years, we have spent building the largest AD-PKD patient-reported outcomes data set. But during this time, we have realized that there is room for growth and expansion. So something that we'll touch on here are two of the new tools that will be available. So the care summary, it provides an informative one-pager that will be a great conversational tool between patient and physician, and Elise will share more on this in a little bit. But essentially, the care summary pulls together a list of relevant statistics and information from your registry modules into a compact one-pager that hopefully will be able to spark insightful and helpful conversations with your physician. And the personal impact calendar is a very unique approach at visualizing what living with AD-PKD is like. So each day you will have access to a short pulse survey, as previously mentioned on the green dotted line. And this survey will ask about pain, fatigue, and missed days at school, work, or social events due to PKD. And based on your responses, it will be visually mapped onto a calendar. To show more of what the personal impact calendar looks like, we can move to the next slide. So as we can see here, this calendar is showing the days you answered about fatigue. So on the left side there, it has checked bothered by fatigue. So the key under the left side will help you decipher what the colors mean. So for example, the green means that you mentioned that you were not bothered by fatigue, and the red means extremely. So we hope that this is a new tool that can be used to aid in your personal understanding of how PKD impacts your life, but also a conversation tool for you and your physician. It can be really difficult to remember the last, 6 months, few months, or a year, however much time that is between your appointments, with your physician. But being able to look back and having access to this calendar could hopefully make those conversations not only easier, but more nuanced. You're able to actually remember, in January, I charted, I had this week here where I was really having a difficult time. Or, maybe it's a chance to not only note the tough times you're going through, but maybe, that you're not having any pain at all and things are getting better. So we're really hoping that this tool will be used in a way that really personally impacts your life, which is how we created the name. And also we wanted to share what exactly the questions are. So we have put those on the right side of the screen, and we have pulled these, the first 3 from the validated tools. And then the last question we created with our patient advisory group to really help understand, that time lost from, this disease and how it really impacts your life. So we're really excited about this tool. It can be used every single day if you want to. Again, it's optional. And there's also a way for you to be notified by text system. So if you just would like to receive a text once a week to say, hey, you still have your pulse survey here, we have the ability to do that now. So hopefully, this will be valuable for your personal life, and you feel like we are really able to return that understanding to you from the registry.
Thanks, Vanessa. So we'll be talking more about what connecting your health records means in a minute. But first, I wanted to stop and see if you had any questions about the annual impact report itself. If you do, feel free to put those into the questions or chat. We'd be happy to answer them. Looks like I have one that came in through the questions so far. Vanessa, can you talk about how you came up with the categories and the personal impact calendar? I know you talked about the impact tools and the time lost. Anything else you want to add to that?
Yeah, so the impact calendar was really born from listening to conversations with our patient advisory group, the Registry patient advisory group, and hearing, just the differences in how people experience this disease and how it can be difficult sometimes, like I mentioned, when you're going to the physician and you can't remember things, or it just seems like there's so much to track. You're being asked about, diet, lifestyle, all these things, and pain, fatigue, and everything. And I was just thinking, wouldn't it be really great to be able to track that in a really easy way, but also not just a journal, but to be able to visually see, how, your life is being impacted. So we wanted to draw from the impact scale, the ADPKD-IS. So we ask about pain and fatigue, since we know that those are validated questions, and also our participants are used to seeing those questions, but also to introduce that new question at the very end, asking about time lost for work in school and social events, because sometimes you may feel up to going to work, but then after work you have to miss a family member's birthday party because you really just weren't feeling well. And maybe that doesn't stick out to you, but when we ask it this way very directly, it is something to think about, how your life is being affected. And again, the whole purpose is to create a better understanding personally of your disease, being able to track it easily, and to share with your physician in an easy way.
All right, let's move on. Again, feel free to put any questions you have in there for us. Vanessa, I forget, are you speaking to this or am I?
I think you are.
Okay, perfect. So just really quickly, we wanted to talk about why joining a registry opens doors for more and better research. Physicians collect many lab values, but only patients can tell us how the disease really impacts them. So we advocate for the use of patient-reported outcomes, which is basically a survey or a module like you're answering in the registry, to really highlight the impacts on a daily life. So some of the challenges that we see in research for PKD are, a limited understanding of how the disease progresses. Sometimes it takes decades for PKD to progress in a way to help us really understand the speed and potential for rapid decline in your kidneys. So a tool like the registry to help us follow you over years is incredibly valuable, and it's not really found in many other places in the US. Patients are spread, of course, throughout the US over a diverse geographic area. You're seen at many different clinics. So a nationwide centralized database doesn't restrict to individuals seen at a single clinic or in a single city. So it just really enhances our understanding of where our community is located. Researchers are incentivized to keep hold of their data and not share it because they need to publicize their results to, maintain the integrity of their work and their research questions. Can't entirely blame them for it, but we wanted to provide a de-identified data source where sharing is key and integral to the program goals. And then, of course, studies struggle to find participants, which means that it takes longer for us to understand if a certain therapy might work in ADPKD. So having a way to share research studies that you may be eligible for is just really helpful in understanding your opportunities for participating in a study and connecting researchers to potential patients. And then just why is longitudinality important? We just talked about that. It's not just about a single moment in time. It is about understanding over years how this disease is progressing and impacting you. So just wanted to highlight that we do ask you to fill out some of these more than once, and we understand can be really frustrating and time consuming. And so something we've done in the new version is created an autofill of your previous answers. So for example, in the core questionnaire, we ask you about your current kidney function, your symptoms, clinical trial eligibility kind of questions. And if nothing has changed or very little has changed, you could scroll through, confirm, tweak here and there, and submit. And we're hoping that's going to save you a lot of time. Let's talk about, go ahead, Vanessa.
No, you're fine. About longitudinality is that, we really do want to create a robust data set. And this means, focusing not only on the number of participants, but also on the depth. So this longitudinal piece is super important. I just wanted to add that.
Great point. Okay, so as Vanessa has been talking about, we do have some enhanced features of the registry. So we're asking everyone to transition to our new website. We're still hosting the data in the same place. It is still secure, but we just want to make sure that we let you know what is happening if you see a new login. So for existing participants, we'll be sending you an email that gives you a link to the new website. All you have to do is click on that link and reset your password. And you'll see this message here asking you to re-verify a few things about your location, your transplant status, and to review our revised consent form before you can go into the registry. And it's a bit of a pain, and we thank you for your patience. I think we're really excited about this upgrade. I think that's been obvious in our conversation today. It's really going to allow us to grow the kinds of data we collect, and I think you'll see as soon as you log in the enhancements from the last version. I'm sorry, there's a cat fight in my room. Vanessa, can you speak to the next slide for me?
Yeah, of course. So as Elise just mentioned, that is what existing participants will see when the new updated version of the registry is live. But for new participants, this is what you will see when you first choose to sign up. So right now, I also want to note that right now we are not accepting new participants, but we do have a link to fill out and to be on a listserv to be notified of when the updated version is available. So as mentioned, this is coming very soon, but once it is live, this is what you'll see. It's the screen is, the sign up process is very easy and straightforward and to the point. We have been able to update this sign up and consent process based on feedback given by our patient advisory group, and we are really looking forward to being able to put this into action.
Thank you. Sorry about that, everyone. Quite loud in here. Okay, so I want to talk to you about what it looks like to share your electronic health record. Again, this is a brand new feature. It is optional. So what's exciting about this is that the 21st Century Cures Act was passed a few years ago, providing regulations aimed towards care providers that ensures that you own your own data and you control your own health records. And that's exciting for us because it means you have more control over whether or not you want to share them with researchers. So what this means is that the registry now has the capability to connect you directly with your healthcare provider portal. So if you have a portal with your provider, it will have a unique login for you, and you would use that login through the registry to connect. And the kinds of data that we're looking for are details of your ADPKD diagnosis and progression, any current medications you're taking, vital signs such as blood pressure from your clinic visits, the names and specialties of all your healthcare providers to help us understand your care network, other lab results such as kidney function, blood and urine tests. And then, as I mentioned before, other potentially related health conditions outside of the kidney, which are so understudied. Oh, sorry for when I just lost my screen. There it is. And I want to talk about what we're going to do with this health data. So we're going to be using our partner, OneUp Health, which will automatically pair your data from your health record with your participant ID. This is going to make it instantly de-identified, and Vanessa and I and our team will not be able to see your name or other identifiable information from your health records. We're going to pair your health records with your survey responses, which is so exciting. This cannot be found anywhere else on a national scale. We're going to include this data as a large data set as a whole to researchers in our new data sharing portal. So what's exciting about this is it's not going to be just Vanessa and I going to conferences and sharing data from the registry. We're going to be able to exponentially increase the impact and the reach of the data because researchers will be taking it to answer their research questions and sharing it on their own posters. But of course, researchers can't just access whatever data they want. We have a secure process that reviews all data access requests with an external advisory groups of our researchers and experts, and we have them sign a very specific agreement to make sure your privacy and security and de-identification is in place. Again, this feature is optional, but we're just really excited about the potential impact and scale of the kinds of data we'll be able to collect. But we don't just want to take, we also want to give back. So Vanessa mentioned this care summary. It's one of the new features of the enhanced registry, and will not only use your survey responses, but potentially some data from your health records to show you trends that we hope will be useful in conversations with your doctor. And for those of you who see perhaps a known ADPKD expert, someone in our Center of Excellence network, that's fantastic, and they probably are already going to be able to talk you through all the important parts of your disease journey. But some nephrologists who aren't as well versed in what ADPKD looks like, it might be really helpful to have some of these trends and some context for why it's important to understand these trends, and just really start a conversation and provide you with tools to ask new questions from your doctor. One example is this kidney function over time graph. This can either track your survey responses from the core questionnaire where you report your latest kidney function, or in addition to, if you connect your health records, it will pull this from your lab values, your lab tests. So there's a lot of utility in this and understanding the progress of your kidney function. And we'll also show you where your care team members are located to make sure your clinicians work together and understand the variety of specialists you may be seeing for your given experience. We'll also be able to track your blood pressure alongside research recommendations. So this green box is the HALT PKD study recommended blood pressure range to impact and slow disease progression. So we are not going to be interpreting any of your data, but we are going to highlight some things that are important from the field, just to make sure you're having those conversations and we hope this will be of value to you. Like Vanessa said, it's intended to be a one-pager that you can print to bring with you. But as we see how useful this is for both you and your care team, we'll be able to modify and add to it. All right, so I saw some questions come in. I'm going to go ahead and just move my screen. Okay, one question. What is the favorite capability of the registry for research institutions? What is their #1 requested feature? That is a great question. The #1 requested feature was that we create a data sharing portal. So we're going to be able to finally give them access to this data. You know, this is not a novel concept to create a data sharing portal. Many registries and studies share the data so that new research questions can be asked. So we are going to be using the model we've seen in other organizations, and we really hope that researchers find that useful, and at the very least they can explore the kinds of data we're collecting in the registry. Vanessa, maybe you can answer this question. How should I introduce the impact report to my doctor or nephrologist, the personal impact calendar? Oh, you know, actually, I'm sorry, I believe they meant the 2022 registry impact report, but maybe you could speak to both.
Yeah, so I think, you know, both are super valuable tools. I think if you were to introduce the annual impact report, I would mention that it is based on a clinical study online for ADPKD patients, and you know, just go through it with, was it to a clinician that they were looking to share it with?
Yes.
Yeah, I think that, you know, what we found when we were at conferences is that these were flying off the table. I mean, all clinicians were really interested in what we were collecting. So I hope that they will be open to this information that you're sharing with them. I think as long as you highlight, you know, that it is a clinical study, there's around 2,700 participants. This is what they're learning, and I think it'd be really great for you, clinician, to see you know, if that is able to help guide conversation. But if you're also looking to share your personal impact calendar with your physician, I would hope that you have I think that this calendar can help, you know, hopefully give you the confidence if that is not the type of relationship you currently have with your provider, to be able to bring up these conversations, because PKD, ADPKD, you know, it is a disease that you're living with, and it can feel really heavy at times. And so bringing this up to your physician, you know, you can maybe say something like, I have been charting and tracking how this disease has been affecting me. I've been doing this through an online resource that the PKD Foundation has through their registry, and just go through it with them. Just show, you know, maybe times you've been doing well, times you haven't been doing well, and maybe that again can just help guide that conversation with your physician going forward.
Excellent, great, perfect answer. I see another question here. What if you have a portal with a university for transplant and a liver physician care, but also a separate portal for your primary nephrologist? Great question. So the registry will be able to connect as many provider portals as you feel comfortable connecting. You know, I think the bigger picture that we have of the kind of specialists you see, the more we're going to learn. And also, of course, the foundation still has a lot to learn about how many specialists you see for your ADPKD and for other non-kidney related complications. And so it's just really informative for us to understand how many clinicians you see and you have over time, where you are now, or that you maybe saw 5 years ago and no longer see again. It's really impactful. So the portal will allow you to connect as many as you're comfortable sharing. And it looks like we're about at time. So thank you everyone so much for joining us. We loved talking to you tonight. Vanessa and I are very willing to talk to you further if you have more questions or concerns or comments on the program, on the report. Yeah, we love talking about this work, and we are always looking for feedback and new ways to return value. You'll get an email after this with a quick survey. If you'd please fill that out for us. And then also a link to the website where you can download the report for yourself. And if you want to go ahead and request a paper version, we can mail one to you. So thanks again so much. Vanessa, any final words?
Yeah, I just want to thank everyone for tuning in tonight. I'd also like to acknowledge our Patient Registry Advisory Committee, our Patient Advisory Group, and also others from our PKD Foundation team who have made this all possible. Yes.
Missed a slide. And then here are our emails and also the website for the registry. All right, everyone have a fantastic night. Thank you so much.
Thank you.
Bye.